Professor Chief LaVie. Are you with us now?
Yes, I sure am. I'm trying to share my slides right now. Let me make sure that they're on. Let's see. Can y'all see the slides? Can y'all hear me and see the slides?
Yes, we can see
Okay.
the slides.
And you can hear me
to
too?
hear from you.
Okay, well, great. Thank you for inviting me to do this talk. This is certainly a different kind of talk than I normally do, but hopefully I can give some inspiration. I certainly do a lot of work with the journals. I, for example, in 2007, became section editor of the Mayo Clinic Proceedings and one of the associate editors, the only one outside of the Mayo Clinic. I'm also an associate editor of 3 other journals, an editor of my own journal, and on the editorial board of over 40 journals. I actually got my 1014 paper on PubMed this morning. And my H index, and we'll explain what that is later, is 130. I'm also editor-in-chief of a pretty good journal, Progress in Cardiovascular Diseases, that when I took over in 2014, had an impact factor of 2, and now it's up to 8.914, which is a quite solid impact factor. And we have a lot of really good papers. So this journal is doing quite well. So I think that for all of you who are interested in publishing, how do you rate journals, for example? We rate it in prestige, obviously New England Journal and Lancet and JAMA. Readership matters, media coverage, lay opinions, generally the medical status and the subspecialty matter. Impact factor is very important. It takes journals a few years to get this. It has to be accepted onto Index Medicus. At minimum, a journal needs 2 years to get this. It's an indicator of how often papers from that journal are cited. And they actually give an impact factor with or without self-citation. So sometimes editors can pad their impact factor by making the authors cite some papers from the journal. Not all articles count in the impact factor, but anytime a citation is given, it counts. The only thing that counts when the journal is counting impact factors, original papers and reviews. They usually don't count the editorials, commentaries, letters, and including research letters. So that's actually an avenue that a lot of journals are trying to get authors to switch their paper to a research letter, because then if it gets cited, it helps the journal. If it doesn't get cited, it doesn't hurt the journal. A 2021 impact factor comes out in June 2022. So in a few months, we'll get the next impact factor. And that's going to be journals 2019 and 2020 papers that are cited during 2021. So papers published in 2021 and cited in 2021 do not count for that impact factor. They only count when they cited in 2022 and 2023. A lot of journals are happy just to have an impact factor, and having one that's 1 to 2.5 is a start. A lot of institutions around the world only count papers in journals that are greater than 2.5, sometimes for their promotions. 2.5 to 5 is solid. 5 to 10 is quite good. At the Mayo Clinic Proceedings, it's 7.616, and I showed you that my Progress in Cardiovascular Disease is 8.194. And above 10 are excellent. And many of our top cardiovascular journals like JACC, European Heart Journal, Circulation, have impact factors close to 30. Generally, most people count the impact factor as the most important, but there are other categories to grade a journal. But I think really, most people focus on the impact factor. So if you're an author, how is your authorship judged? A lot of times you heard mentioned my number of publications. So a lot of times the number of publications matters. It matters how many are on PubMed versus not on PubMed. How many are first authored? How many are second or third authors? How many are in good journals? And how many of your papers are cited in the citation history? Citations, sometimes some universities look at the citation without self-citations. And we'll talk about the H-index. H-index is the number of publications with so many citations. So for example, if somebody has an H-index of 10, that means they have 10 papers that have been cited at least 10 times. And you could give this with or without self-citations. And generally, this is from the Web of Science on Index Medicus journals. Google Scholar has a Google Scholar in H-index, but generally the Google Scholar is different than the Web of Science H-index. I think most people are starting to like the Google Scholar because it's so easy to use. The types of papers do matter too. Is it original research? Is it a randomized trial, subgroup analysis, retrospective studies, a meta-analysis, systematic review, state-of-the-arts, invited or uninvited, mini reviews? Editorials are generally invited. Commentaries are sometimes invited and sometimes are unsolicited, but generally you need to have expertise in the field to be asked to write editorials and commentaries. Opinion pieces of viewpoints. This letters to the editor, and I mentioned earlier that research letters to the editor now, many journals like these because they're short and they still count as a publication for the author, but then they don't count they don't count as a paper for the journal. So if it doesn't get cited, it doesn't end up hurting the journal. So you heard my stats mentioned as far as the publications. It is true that I have over 1,500 journal publications, 600 abstracts, 70 book chapters. I had my 1,014th paper that came out on PubMed this morning, 350 are as first author, about 300 a senior author. My Google Scholar H-index is 130, which means 130 of my papers have been cited at least 130 times. Now, there's also something called an I-10 index. I-10 index is how many of your papers have been cited at least 10 times. And 670 of my papers have been cited at least 10 times. And totally, I have 150,000 citations of my papers in the literature. Now, a lot of people wonder, you know, for young authors, getting started writing a paper is difficult. Many are limited about what is available: time, data, statistics, statistical skills, mentoring, etc. You have to make a game plan, and you most of the time need a mentor with proven success. If you're getting a mentor who hasn't published much, they're probably not going to get your paper published. There are many reasons to publish. One, it's certainly a lot of fun and you make a lot of friends, but sometimes you need these to get accepted into training programs, to get accepted for faculty positions, to get promoted. Sometimes the salary is higher with more publications, getting tenure, getting grants. So when you're getting started, you have to choose your paper. Original prospective is probably the best thing, but it takes time. You have to plan the study. You have to get IRB approval. A lot of times it's much easier to do a retrospective study or reviews, systematic meta-analyses, state-of-the-art mini reviews, concise reviews. Commentaries and are generally more from people with expertise. Letters to the editors count. Research letters to the editor count as actually a paper by the author, but not by the journal. So when you're getting started, writing a paper can seem like a daunting task. Just for example, a paper might be 15 typed pages, over 3,000 words, 3 to 5 tables and or figures, 30 to 50 references. So for the novice, this can seem quite daunting, quite prohibitive or overwhelming. But really, you have to divide the paper into small sections. And just for example, original research paper, you can make writing this ridiculously simple and organizing the paper correctly. You know, you think about it, the paper is the tables and figures, the abstract, the introduction, the methods, the results, the discussion, and the conclusion. And each one of these sections has small sections. The tables are the most important for original data. You have the tables that basically summarize all of your data. And just for example, you know, you could have 3 tables, 2 figures. Sometimes you have a summary figure in some of the big journals summarizing the main points of your article. Starting off with the abstract. The abstract is also divided into several sections: a background, a methods, a results, conclusions, one or two main findings. The introduction is generally divided into three parts. You have a background, and then you have a second paragraph, usually talking about some specific aspects of your study, how it's different than what's been done. And then the third paragraph is basically saying what your study is going to do, analyzing so many patients, randomized, or retrospectively analyzed. The methods is also divided into parts. Part one is usually the study population. Part two is your study design, and part three is the statistics. And then your results is generally basically just taking all your tables and figures and putting them into words, and maybe saying a few words about each table and figure, and giving the background information data on your study. The discussion also divided into parts. The part one is the first paragraph, summary of the findings of your study. And you might have a couple of points in that first paragraph. And then paragraph two is usually the material about your study that's different than what's been done before. Then you have other paragraphs to how you position your paper compared to other papers. You might have a section on strengths and limitations of your study. And then you conclude also a couple of main points. Basically, a lot of times the conclusion will have the first couple of points that you make in the first lines of your discussion. And generally you have 1, 2, or 3 points in your conclusion, which are your main study findings and how positioning your paper and maybe talking about the future. So really, when you think about writing a paper, if you think about it as a big deal, it can be overwhelming. But really, your paper is 30 small parts that are all very short and basically stapled together. Basically, the final paper is taking these 30 small parts and pasting or stapling them all together. And so really, if you think about it as all the 30 small things, it's not as daunting to be able to do that. And then there's other papers too that you can obviously write non-original research papers, state of the arts. Generally, to write a state of the art, you need experience on the topic, and you need someone who's probably published on the topic. Same thing for many times for editorials and commentaries. So when you're getting your papers done, you're thinking about your journal, what do journals want? We certainly need to fill out pages. We want good scientific content that is accurate, honest, unique, and of interest to the readership. Many of our journals do plagiarism scanning, so we use software to look to see, do you just copy things out of other journals? And we certainly want our papers to be cited. And so how do we try to achieve these goals? We try to get great content. It's always helpful to have some high-powered institutions and co-authors on papers that have been proven publications. This is even more important for review articles than original research. But you have to do what you can do based on what's around you and have reasonable expectations. And again, publishing improves one's skills. It improves your clinical skills. The perfect combination is probably being a top clinician or scientist, a great teacher, and a successful researcher and publisher. But playing the publication game is challenging, but it's a lot of fun. And my co-authors have become some of my best friends and colleagues. Publishing opens many doors, and good luck to all of you with your papers. Now, as mentioned, I'm doing this with full clinical loads. Almost every day today, I'm assigned to the echo lab, where I'll probably be doing 3 or 4 TEEs, reading 40 or 50 echoes and stress tests. Yesterday, I was in the clinic, seeing 20 patients in the clinic. I give about 75 to 100 lectures per year. I have a family. I've been married for 41 years, and I have 4 adult children. 3 of them are physicians. And all of my kids, when they went to college, all of them said they were not going to go into medicine. because all I did was work. And finally, they realized that I was doing all this work because it was fun. I exercise 365 days a year, mostly by running, but I also try to do some resistance exercise. A lot of people say, how do you do all of this? And I did it early by probably losing sleep. Probably in my early days, I was getting 5 hours sleep a lot of days, and 6 was like a really good day. Lately, I've been trying to get 6.5 to 7 hours sleep. I generally do 45 to 60 minutes of work at home before leaving for work in the morning. I have a pretty frantic pace during the day because my clinical loads are huge. I'm getting 375 emails a day on an average day, 75 emails a day on a weekend, and have all the academic work. So I'm doing all of this work in between every patient, every echo, every stress test, every TE. I generally do 2 to 4 hours at home most nights, and I do 4 to 6 hours per day on weekends, vacation days, and holidays. I think you have to stay organized, and every day I do a to-do list of what I'm going to try to get done today. And many times I don't get through it all, but I try to get through the most on my to-do list before I close down at night. And certainly I have the help of lots of friends and co-authors, both here at Ochsner, in the United States and worldwide, helping on all of these papers. And it's a lot of fun. And certainly I don't consider it all work. I think that it's been a great hobby as well. And so I certainly really have enjoyed it. That's kind of a fast overview. Like I said, I've never given a lecture like this, but the idea of this lecture was to try to inspire you. I hope I've inspired some of you to try to see the not only the benefits of clinical care, but also the benefits of working with journals and publishing. It's a lot of fun, and it can open up a lot of doors. But thank you very much. I'll be glad to take any comments or questions.
Thank you. First of all, on behalf of me, the president of the conference, I'm Ahmed Tamara. It is a pleasure to welcome Dr. LaVie to Cardio Must 2022, figures in the field of cardiac rehabilitation. Also, by the way, the founder of cardiac rehabilitation here in Egypt, Dr. Salim, is sending you her regards from Montreal. And
that's one of the areas, probably some of the areas that I've published the most in, are cardiac rehabilitation and exercise, generally physical activity and fitness. I'm rated first in the world by expertscapes.com in those areas, as well as in obesity and body composition. But pretty much a lot of my papers are in many aspects of preventive cardiology and even in heart failure, on heart failure topics like obesity and heart failure and cardiopulmonary stress testing, and things like that. So I've tried to, and a lot of omega-3 fish oil papers. So it's been a lot of fun having a variety of different topics. But cardiac rehabilitation is certainly as one of my biggest topics for sure.
Thank you, sir. We'll let the floor if any questions. But I want to tell you that the European Society of Cardiology had recently classified Egypt as having one of the most comprehensive programs, including diet modification, smoking cessation, and psychosexual counseling, side by side by Holland and Italy. Please, Dr. Mahmoud, I see that you are raising your hand to ask a question. Yes.
I would like to thank you for taking the time to speak to us today. It must be at night in your time, and
it's actually early in the morning. It's early morning here.
Yeah, it's very nice having you, and I also want to really encourage the publications here in Egypt. We do a lot of research that goes unpublished, maybe because of the financial aspects. And we get to see varieties because of the demographics that can really bring something different to the table. And I think my university is kind of taking a step towards making that more possible and supporting the finances of publication. So, and definitely bringing someone like yourself to really just shine some light into it is definitely something to be proud of. Thank you.
You know, and obviously having funding is very helpful, but a lot of work can be done without funding too. You know, there's a lot of stuff that you can analyze data banks with with just hard work and sweat. So obviously funding helps, but you can still get a lot done with fairly little funding if there's motivation.
Thanks, Dr. LaVie, for this presentation. We were eager to hear from you how you can do this. Finally, I just want you to give a piece of advice to all doctors who are struggling with patients and research.
Yeah, so I mean, obviously, there's time. People want to, obviously not everyone is going to want to be working around the clock. I mean, people want to have their social lives, they want to have their personal lives, their family lives. Obviously, some people, as you know, work faster than others. Some people, if they had, so many patients in the clinic, they can finish the patients through the clinic and get all their notes done and have the computers all taken care of quickly, and other people it takes longer. So I mean, it certainly is a big help to be able to work faster, and I don't think people who don't work fast purposely try to work slow, but having I think sometimes it ends up being harder to work fast. And if someone it becomes more successful working fast, obviously you can get a lot more done. In the clinical world, you can see a lot more patients. You can get a lot more clinical procedures done if you work fast, or you can, and so that certainly is gaining your skills and perfecting to where you can be thorough but fast is a major help. And certainly, you have to have the motivation to be doing research. And I think obviously the people who are most successful with doing research and doing academic work are people who love it. And remember, you can be successful without publishing. You can be successful by being a great teacher, by being a great mentor to young people. I think that I think the publications certainly add to one's credentials, and I think that I mean, when you're getting asked to speak at the American Heart Association, European Society of Cardiology, and the American College of Cardiology, and then big national, international conferences, generally the people who are given many of the presentations it's based on their publications. It's based on work that they're published in the peer-reviewed journals. And so to make it to that level, you have to be able to generally to show some good publications. And I think that obviously the person who enjoys it, who is going to be motivated to do the most. So it's going to be hard to be successful if you don't enjoy it. But even if you don't love it as much as someone else, I think doing it a little bit can pay rewards, because it can help you move up the ladder at your university, the ladder at your in your profession, and the ladder in your field, and it certainly opens doors. And so I do encourage you, at least not everyone's going to be a publisher. And the most important thing is to be good at taking care of patients. That's the number one thing for sure. But I think adding to that, the academic work can be extremely rewarding, both personally and for your profession.
Thanks, Professor Chip. Really motivating presentation, and I'm personally motivated